I will have to take Lu, which I don't want to because I'm not in my city. I'm traveling with so many people, so they're waiting for me to go
No,
out.
you can leave, madam. You can
I
leave,
will. I
madam.
will stay for 5 minutes and then I will leave. Thank you so much.
Because our next speaker, she is also traveling. She is in Nepal.
Okay.
And Dr.
All
Medi
right.
Gupta is in Nepal, and you are also traveling. So today is a traveling day for us.
I think so.
Thank you. Today our guest is Dr. Vaidehi Kumari Gupta, MD Homeopathy. She is Assistant Professor, Department of Practice of Medicine, Dr. R.D. Singh, Gaya Homeopathy Medical College and Hospital, both Gaya, Bihar. And the topic is facial features of Psora. We all know that the relevance of this miasm Psora, because Hahnemann invented when a situation arises that their beginning was promising, continuation less favorable, and outcome hopeless. That was the situation Hahnemann faced. So he developed the Sora theory and he defined beautifully the most ancient, the most destructive, yet the most misappropriated chronic miasm is a wonderful definition is there. You can see in the chronic disease textbooks. So on behalf of IFPH, I am welcome Dr. Vaidehi. You can have the platform for the next 45 minutes. It's over to you. Please proceed.
Thank you, sir. Thank you for such a kind words. And thank you, IFPH, for giving me such a wonderful platform. I'm just sharing my screen.
Yes, you can, as a host. Please.
Is my screen visible?
Yes, of course.
Okay. So the topic is facial features of Sora. Introduction. You cannot judge a book by its cover. It is a very popular saying, but it's not true always because especially in homeopathy, we can judge a person by the way he look, by the way he talk, or the way he walk. So everything is important. So when we say that we can't judge a person by the way he look is not entirely accurate. Yes, we can. Like facial structure can determine with reliability their dominant masm, because when we calculate like these are like points, like when we tell someone about the type of eyes, the type of ear, then we are just calculating them and we can determine which one is the dominant masm. Like hairline. Talking about hairline, the example is widow's peak. The widow's peak is where the fringe of the hairline creates a downward triangular peak with sharp point. It looks like a triangle where the base is in upside and the apex is in downward. There is a fringe of hair which looks like this inverted triangle. So this is widow's peak. The shaded area is that inverted triangle. There is a pointed fringe in the middle portion, while in the rest of the portion there is no hair. This is called widow's peak. This is the original picture of widow's peak. The dotted line indicates the margin of the hairline. Now, what is the literal meaning of widow's peak? Looks like a peak of a widow's hood, like a headdress. It was actually worn by women who are widow. So it looks like a triangular, inverted triangular area, particularly the distinctly hood with a pointed piece in front, which widows wore as a hood of the mourning. That's why it is named as widow's peak. Next one is M shape. The M shape hairline is where the fringe of the hairline may be rounded to form an M. So the hairline will be in the shape of M. It will be not that much pointed like M, but it looks quite similar to letter M. So this is M shape hairline. We can see by this dotted line that it looks like a letter M. Now forehead. The forehead will be sloped. Sloped is very prominent in soramasm. The forehead will be sloped, the eyes will be slightly sloped, the ear will be sloped, chin will be sloped. So sloped feature is quite prominent in soramasm. So what is the criteria of that sloped forehead? When with the vertical line, when the forehead makes an angle of 12 degree or more than 12 degree, it will be considered as sloped forehead. These are pictures of sloped forehead where the angle will be more than 12 degree or 12 degree. This is the original picture of sloped forehead. We can see in second figure there is a dotted line that indicates that incline. It is slightly slant. Now eyes. Eyes will be downturned eyes. Eyes slope downward at a more pronounced angle than the first half of the upper eyelid. So in figure we can see that on the top figure it's quite normal, but in the lower picture it's slightly depressed in the lateral portion and slightly angulated. So the medial canthus will be slight superior portion and the lateral canthus will be appear like slightly downward phase. So medial canthus will be raised slightly and lateral canthus will be slightly depressed, slightly low to the normal level. So these are downturned eyes. These are also examples of downturned eyes where the lateral canthus is slightly below in comparison to the middle one. This is the original picture of downturned eyes. Now closed set eyes. When the inner canthus of each eye appear close to the bridge of the nose than average. So in the upper figure it's quite normal, it is in the midline, while when we tell about closed set eyes they would be quite closer to each other. They are quite close to the bridge of nose, they are quite close to each other, that's why they are named as closed set eyes. It is also present in soramasm. This is a picture with an example of closed set eyes. These are also some examples of closed set eyes where the eyes look quite closer to each other in comparison to other facial features. Now small eyes. It is a visual interpretation in context with other facial features. Like in these pictures, the eyes are quite small in comparison to other facial features. The forehead is quite broad, the nose is quite broad, lips are full, chin is quite long, but in comparison to all these features, the eyes look slightly smaller. So these are small eyes. This is the original picture of a small eyes. Now small and downturned eyes. Then when we tell about small eyes, it will get 1 point. When we say small and downturned eyes, it will get 2 points. First, small eyes, it is also prominent in soramasm, and downturned eyes, it is also present in soramasm. So it is small and the lateral canthus is slightly below in comparison to medial canthus. So this type of faces will get 2 points for sora. Full lids. Full lids extend over the eyeball, covering an area of 30% or more than 30%. So when the lids will cover the eyes, and when this coverage is more than 30% or equal to 30%, it will be considered as full lids. It will be considered as sora. So this is a picture of full lids. Here, full lids with downturned eyes. So this face will get 2 points. 1 point for full lids, which is present in sora. Also, the lateral canthus is slightly below in comparison to medial canthus. So it is a downturned eyes. So overall, this face will get 2 points for soramasm. Full lids and small eyes. It will also get 2 points because majority portion of the eyes is covered by the lid, which is more than 30%, and the eyes are small, so it is also a feature of sora. Now nose. When we divide nose in 3 hypothetical portion, upper portion, middle 1/3 and lower 1/3, generally there is a bump on nose and it is more prominent in the upper portion, generally located in the upper third of the length of the nose. In some cases, it will be in the lower third. It may be in upper third, it may be in lower third, it may be in middle third, but the upper portion is quite common. A bump with further down the nose will give an overall curved or hawkish appearance. And when this bump is at the end of the nose, it will give a feature of slightly down of the nose, and that's why it look like a hawk, that like a beak of hawk. So it will give as a hawkish appearance. Nose bump in upper third. In both of the picture, there is a nose bump, and nose bump is in the upper third of the nose. Nose bump in lower third of the nose, we can quite clearly see that the nose bump is present, and it is present in the lower third of the nose. Downward or curved nose. Tip of the nose is lower than the junction of the nose to the face. Means the point where the nose is attached to the face, the tip will be more lower to that junction. A definite downward curve, that is called hooked nose or hawkish appearance. So it will look like a beak of a hawk or like a hook. That's why it is called a hook nose, hawkish appearance, or downward or curved nose. So these are downward nose. It will be slightly lower in comparison to normal one, and it is slightly lower at the junction where the nose and the face combine. Curved nose. The nose will be not straight, it will be slightly curved. It is also a feature of Psora. Downturned with a bump. Here this face will get 2 points, one for downturned and other with a bump. In the lower portion it is hawkish, that's why it is called downturned, and there is also a bump, that's why it will get 2 points. Mouth. A small mouth. When the mouth will be slightly small, like when eyes look small, it's Psora. So when mouth looks small in comparison to other facial feature, it is also considered as Psora. So if hypothetical lines are drawn downward in a straight line from the wings of the nose to the mouth, a small mouth lies inside these lines. So when we draw a hypothetical line from the wings of the nose, and it will be quite smaller, that's why they will come inside those lines. Small mouth showing hypothetical lines. So first one is just a figure, and in second figure we can see those lines. These are hypothetical line, and the mouth lies between these two lines. Small mouth. It's also again small mouth. Now lips. It is a visual impression, but there may be some problem, like lipstick can be a problem. With the help of lipstick, the lips may look thin, so it will be slight confusing when the patient applies lipstick and then they come to the clinic. Also smiling pulls the lips, making them look thin. So when during smiling the lips will stretch and it looks thin, so we have to take care that there is not the lipstick is not applied, and also they are not smiling. It will be in a normal face, like a poker face, then we can conclude quite clearly where there is no expression. So thin lips, these are examples of thin lips. This is the original picture of thin lips. Small mouth and thin lips. The mouth is small as well as the lips are thin, so this will be considered as 2 points. Smile. Compact smile. The dental arch is smaller and more compact. Compact means they are quite close to each other. Then there will be some space left and it can be seen visually. So there is a space between the teeth and inside of the mouth. This is an example of compact smile. The red shaded area is the space which can be seen easily, and it is an example of compact smile because the arch is quite close, quite small. Teeth. Two front teeth. When the two front teeth look more prominent, large or forward than the teeth beside them. So in the entire row there will be two front teeth that will look different in comparison to the other one. This can give a rabbit or bucky appearance. So it will look like a rabbit, or that's why it is also called rabbit teeth or bucky teeth. It looks like teeth of rabbits. Prominent front teeth longer. In this picture, all the teeth are aligned in the same row, but front two teeth are slightly longer in comparison to other one. So it will be considered as soramasm. The two front teeth are considerably longer than the other teeth. This is an original picture where everything is fine, but the front one is slightly broader and slightly longer. Another example is the two front teeth stand out from the other teeth. All the teeth are aligned in the same line, but here these two teeth are, although they are slightly broad, long, they are also slightly slightly inclined, so they look quite different. They are outstand from other one. So when the two prominent teeth are different from the entire row, it will be considered as Psora. Chin. So sloping chin, like sloping forehead, there is also sloping chin. The chin lies back from the mouth. Hypothetical line vertically either from between the eyes or upper lip. So here we can draw a line either between the eyes or from the upper lip, and we can see that the chin is slightly back in comparison to the whole features. The sloping chin sits back from the point. Comparing these two pictures, first one is normal. These are all aligned in the same line, like the lower lip and the chin. It is in the same line. While in the second one, where there is sloping chin, a hypothetical line from between the eyes, we can see that it doesn't cross the line. The chin is not in this line. It's slightly back from the normal. Then it is called sloping chin. This is also an example of sloping chin. Hypothetical line vertically from upper lip. So as I said earlier, we can decide it either by drawing that line from the eyes or from the upper lip. So here the hypothetical line is from upper lip, and we can see that the chin is quite in backward line in comparison to that one. So it is also example of sloping chin. Sloping chin without any defined bone structure. When the chin almost merges to the neck, then it is also called chinless, where we can't see whether the chin is present or not, because it is that much sloping, it is that much backward that it almost merges to the neck. That's why it's called chinless. Ears. Ears high. There are two conditions for Psora. If the eyes are higher than the normal level, it is Psora. When they are lower than the normal level, it is also considered as Psora. So a hypothetical line from the bridge of the nose horizontally towards the back of the head, the top of the ear is visibly higher than this mark. So when the ear is slightly higher to this line, like when joining the nose, bridge of the nose and the back of the head, the ear will be slightly higher than these lines. Then it will be considered as high ears. The first figure is normal one, where a slight portion of ear is above the root of the nose, while in the second figure, which is ear high, majority of portion is above that line, so it will be considered as ears high, and it is Psora. This is also an example of ears high. Now ears low. A hypothetical line from the bridge of the nose horizontally towards the back of the head. The criteria is same. The top of the ear is visibly lower than this line. So when the upper region of the ear is quite lower than this line, it is also considered as Psora, and it is ears low. So ears low, we can see that the ear is very much low in comparison to that hypothetical line. So when it is high, it is also Psora. When it is low, it is also Psora. When it is not in normal position. This is an example of low ears. Ears are quite low. Ear sloped, like sloped forehead, sloped chin. Ear is also sloped. A hypothetical line from inner edge of the lower lobe of the ear to inner edge of the upper part of ear should rest just behind this line. So, in the diagram, there is a vertical line and another line joining the upper inner edge and lower inner edge. When it will make a degree of 20 degree or more than 20 degree, it is considered as sloped ear and it is a sign of psoriasis. So these are examples of sloped ears. The ears are quite inclined and the degree will be more than 20 degree. Sloped and high. Here this will get 2 points. First point for the sloped ear, because it is inclined more than 20 degree and it is also high. The line which is from the root of the nose, from the base of the nose, the ear is quite higher to that line, so it will be sloped and high. Sloped and low. In this figure, the ear is sloped as well as it is low. Lines. Forehead lines. Either across the forehead or in the middle, just above the ear, there will be multiple of lines. Most people, when they frown or look surprised, have a strong and eye-catching lines in their forehead. So when they show their expressions, when they are frowning, when they are angry, when they look surprised, the lines are quite prominent. They are eye-catching line. They may be straight or wave-like, and both are considered in Psora. These are also called worry lines. Multiple lines in the middle of the forehead. So when there are multiple lines in the middle and they are quite straight, it is Psora. Multiple lines across forehead in a wave shape, and when it will be in wave pattern, it will also considered as Psora. Normal lines near eyes. Most adults will have these lines at the corner of eyes, especially when they smile. So when a person smiles, there will be some lines near the eyes, and they are also called crow's feet. So these lines will look like a feet of crow. That's why they are called crow's feet. Crow's feet. In the second figure, the line is shaded and it quite look like the feet of crow. That's why it is called crow's feet. Both pictures are same. The lines are just shaded. Lines extending directly downward from the eyes. So when these lines will extend directly downward, almost perpendicular, it is also considered as Psora. Lines below eyes slant slightly at an angle away from the lower lid of the eyes. In this picture, there are lines, they are from eye, but they are not directly below, they are not almost perpendicular, they are inclined, they are slant, and that slant sloping is quite common in Psora. Lines extending to cheeks. If very deep, these lines may extend to the cheeks. This generally occurs only when smiling. So when smiling, these lines of eyes merge with the cheek. Then when they extend to that extension, it is also Psora. Two or three lines between eyes. They are judged by their depth and are often seen during the consultation, that there will be lines between the two eyes. Two lines extending from the eyebrows. We can see the lines near the eyebrows. There are two lines and they are extending exactly from the eyebrow. This is Psora. Two lines from between the eyebrows. In the earlier one, they were arising just from the eyebrows, but in this one, they are arising between the eyebrows. It is also Psora. Two lines diagonally inward. When these lines are diagonally and in inward region, it is also Psora. two lines unequal length when they are not of almost same length. Earlier they were of about almost same length. When they are unequal, this is also Psora. Multiple fine lines, either all over the face or on the cheek. So when there are multiple fine lines on the face or over the cheek, it is Psora. Multiple fine lines in especially in the cheeks. Skin. Freckles is quite common in Psora. So yellow skin features numerous and cover most of the surface area of the face and easily noticeable. We can easily notice it. Freckles is quite common in Psora and they are numerous. They cover on most of the surface area of the face and they are yellowish in color. So these are freckles of the face. Complete face study. This is a picture of a boy, and the features that concern they are related to Psora are just indicated. I just had the other one, which were from other masm. So when the eyes are downturned, this is symptom of Psora. Freckles, which is not that much visible in the photo, but freckles are present, it is also Psora. So we can calculate it but just by counting the points, like how many features are related to Psora, how many features are related to syphilis or psychosis or others, and then we can find which one is the dominant masm. Front teeth prominent. Two front teeth will be prominent and they will be different from the rest of the teeth. They outstand from the other one. It is Psora. So two teeth, these are prominent and it is sign of Psora. Forehead sloped. Sloping is quite common in Psora. Sloped cheek, sloped chin, sloped forehead, sloped eye, sloped ear. So sloped forehead is Psora. Eye high. So when the imaginary line is crossed through the root of the nose, the ear will be in higher position to that level. So the ears are high. The chin is sloped. We can see that the chin is quite backward in comparison to the upper lip or in comparison to the eye. So when we draw a hypothetical line from the lip, we can see that chin is quite backward to side. So it is a sloped chin. Overall features. Hairline, widow's peak. Widow's peak means inverted triangle. The base will be in upward direction and the apex will be in lower direction. Means it is an inverted triangle. That hairline is called widow's peak. Widow word comes from the word that widows used to wear a headdress for the purpose of mourning. That's why it was called widow's peak. M shape hairline is also from Psora. It will be not that much prominent to M shape, but they are slightly curved and quite look similar to M shape. So M shape hairline is also from Psora. Forehead as a sloping. So it will be sloped when the degree will be 12 degree or when it will be greater than 12 degree. The forehead will consider as sloped forehead. Eyes, downturned eyes when the inner canthus will be slightly upward side and the outer canthus, the lateral one, will be slightly of lower side, then it will be considered as downturned eyes. Close set eyes, when the eyes look quite close to each other, it is called close set eyes. The eyes will look quite close, they will look quite close to each other and also to the bridge of the nose. So these are close set eyes. Small eyes, when the eyes will look small in comparison to other facial feature, like in comparison to forehead, in comparison to nose, in comparison to the lips, the eyes will be small, then they are considered as small eyes. Full lids, when 30% or the more than 30% of eyes is covered by the lids, these are considered full lids and it is also a sign of Psora. Nose, when there will be bump on the nose, it will be considered as Psora. The bump may be in upper third or the lower third. The upper third is more common and downturned when the tip of the nose will be more downward in comparison to the normal one. It is called downturned nose, hawk appearance nose, or hook like nose. Curved nose, when the breeze will be not that much straight, it will be curved, then it is called curved nose. Mouth, when we draw a hypothetical line between the wings of the nose and the mouth will lie within those lines, it is considered a small mouth. So, like a small ear, this is also a small mouth. Lips, thin lips is considered as Psora, and but we have to keep in mind that the patient is not applied any sort of lipstick, or they are not smiling, because of a smiling the lips may stretch and it will appear like a thin lip. So it will be normal face like expressionless or poker face, then we can judge easily whether it's actually thin lips or not. Smile, compact smile, when the denture of the teeth, they are quite close to each other and we can see space mm, around the teeth, it is considered as compact smile and it is also a feature of Psora. Teeth, front two teeth prominent, they may be either large in size or when they outstand from other teeth, it is called then the teeth will be called prominent, and it also look like rabbit teeth. It is also called bucky teeth because it looks like the teeth of rabbit. Chin, like sloped eyes, ear, the chin is also sloped, and we can consider it by drawing a hypothetical line from either from the eyes or from the upper lip, and when it falls quite backward in comparison to these features, it is considered sloped cheek. And when it almost merged to the neck and there is no any sort of prominence, any bony prominence, the feature is called chinless face, and it is also a feature of Psora. Ear, when we draw a line from the root of the nose and the ear lies higher to that, it is high ears. When it lies quite lower to that line, it is low ears. And when they are sloped and makes an angle, it is all these features are of Psora. Lines, when there are multiple lines between the forehead, they may be straight, they may be wavy, and they used to multiple, especially when they are frowning, they are angry, when they are surprised, so we can easily notice it. Below ear, below eyes, we can see just below the eyes, they can be straight, they can be inclined or sloped. Two or three lines near the eyes or the crow's feet, which are also called worry lines, all these lines are prominent, then this is Psora. Between the cheeks, when these lines merge to each other, like those lines of eyes and lines of cheeks, they merge and just make single line, it is also Psora. When there is multiple of fine lines, this is also Psora. In skin, when the freckles are present, they will be in yellow in color, they are multiple in color, all these features are of Psora. Reference, Grant Mentley. This webinar was exclusively collected all the contents from the book of Homeopathic Facial Analysis, which is a Vision publications of 2022. Thank you. I think it just ended quite early in comparison to other one.
Yes, nice presentation, doctor, because it once again makes clear that homeopathy is not an easy subject to study. A lot of reflection is needed. A lot of capability of observation is needed. Because we know that from the history of homeopathy or Hahnemann, his father trained him to think something always. So when a patient comes, it's the duty of the physician to make a good reflection of total to the patient. Moreover, what is more important here is that we will get a clear picture if you have a good idea on that. Because when you know that during the case taking, the patient is hypochondriac. Naturally, they will often express their symptoms in different ways. But when you are very familiar with these objective symptoms, objective signs rather, definitely you will succeed. That's the most important thing. The time for discussion. Those who would like to participate, please raise your hand. Because the participation indicates that how much of you are in or interested or you are listened this program. That's also very important. But unfortunately, during these Zoom sessions, we will not get a real reflection from your face. As you just mentioned about this, the frown face, this lycopodium. You can see our foreign minister often talking with a frown face. So Jaishankar is always. So when you see a patient, the doctor should. Well, I am watching in your face whether I could get something from your face. That's Dr. Vaidehi. How will you describe the small mouth is the large nose? That's so very important. And in the coming days, definitely that will force us to think on that way also. That's very important, very interesting one. So it is up to the duty of the honorable participant to make some comments or observations. That is very much important, and what we are waiting for that. You just mentioned about 12 points. Am I right, Doctor?
Yes, sir.
Vaidehi?
Sorry, sir.
You just mentioned about 12 points. One
Yes,
is the
sir.
hairline, the first one is. You said about the M-shaped hairline, then the widow's hairline. These are very important thing. Without any alteration or if you can observe on the patient's face. Then another you said about this forehead, how the forehead is sloped or not. So it is always it is needed to watch the patient sideways. If you watch him straight, you will not get. So
Yes.
that's also a very important thing. So the side view also is needed for getting this forehead. Then regarding the eyes, you said about this downward eyes, close set eyes, small eyes, then footlids. That if you could able to connect certain medicines to these aspects, then that will be more interesting. What is your opinion, Doctor Vaidehi?
Okay, sir. In future or right now?
Yes. Could you please give some examples? You are doing that.
By when I discuss about the features, like
Vaidehi.
am I audible? Sir, am I audible?
Yes, Dr. Vaidehi.
Yes, sir.
Am I audible?
Yes, sir. I think there is some network issue.
Unfortunately, some network problem is there. Can you hear me?
Yes, sir.
Yes, yes.
It's
What is your
likely-
opinion or suggestions on that?
I used to give my example. Like I also have bucky teeth. My two prominent teeth are quite prominent than other one. I have two dimples which are from syphilis. So I used to give example of myself and
Yes, that's good.
just explain medicine from your side. I also want to hear it.
Yes, especially when you are a teacher in a professional in a homeopathy medical college, should have the capability to explain such way. Because you can stand in front of the students as a typical example. So they will learn with ease.